Rachel. So in my PhD, we were looking at adolescents who were infected with the Epstein-Barr virus. So we gathered actually 200 adolescents that were acutely infected with this virus, because we know that this virus, giving the kissing disease, are also one of the viruses that are known for causing chronic fatigue. So we gathered them as acutely as we could and looked at them 6 months later as well. And one of the things we were interested in was what are the risk factors for those being chronic fatigued at 6 months? And at 6 months, out of the 200s, we looked at approximately 10% would fulfill the criteria for CFS-ME, but almost 50% were substantially fatigued and what we called chronically fatigued. And one of the main risk factors was actually how, during the acute phase, how anxious you were. And being anxious, it seems like for some it's so negative, but actually it's also a positive trait. If you look out in the forest, an anxious mouse, worried mouse will survive much longer than a happy-go-lucky mouse. Additionally, in addition to being a bit anxious, we found that being physically active during the acute phase, we measured how many steps per day were these adolescents doing. It was really interesting. We found that actually being more active during the acute phase was positive. They were less fatigued 6 months later. And we as physicians have been telling our patients for so long, just keep still, keep in bed, but bed rest is out. It's better to be a bit active, not go for a marathon, but be a bit active. Another interesting finding was actually those adolescents that were good at learning things. We tested how good they were at learning random numbers, and those scoring high on learning things were also at higher risk of getting more fatigued. And when we saw these results, we were like, how can we explain this? But now, what has happened the last 10, 15 years with us understanding that symptoms actually is a brain function, and that if your brain is good at learning random numbers, it's good at learning other things as well. And as symptoms being a brain function, it could actually do this associative learning and other forms of learning, making the symptoms stick for longer. So that was some of the risk factors we found in our research.